thing that I forgot to mention earlier was, again, we talked about everybody's going to have the same rate regardless of health conditions. You know, nobody could be charged more because of a pre-existing condition. The federal government did actually, when they wrote this, come out and say the insurance companies could charge smokers 50% more than non-smokers. And again, in California, our legislators thought that was discriminatory, so they nixed that from our coverage here in California.
I feel like a Nevadan now.
So,
is this money going to go into like a general fund, or is it going to go into the lockbox?
that's a good question. Yeah, if it goes to the general fund, you know it's gone.
Yeah.
Yeah, you know it's gone.
It's going to help the deficit.
Okay, Leanne, I don't my husband's a veteran.
Mm-hmm.
What happens to their coverage?
At this point, the veterans' benefits are not impacted by this legislation at all.
Okay, so I'm not working. I don't have insurance. Where do I call?
It depends on your guys' household income and that modified adjusted gross income number. And you shoot me an email, I can tell you where that is on your tax line, and we can see if where you're going to fall here on this schedule, whether it's going to be Medi-Cal, subsidy assistance, or private market. And again, the goal was you could get your insurance on the private market where you'd have a little more flexibility to get the plans that you want. And unfortunately, the insurance companies did not go that direction. They have mirrored, at least on the individual market, not the group market. The group market's still a lot better coverage, but the individual market has chosen to mirror the covered California market.
Let's get a couple more questions in. What else? Sir?
I'd like to address this, please, if you wouldn't mind. You mentioned the religious exemption. There is no religious exemption being in effect. And in fact, what's happening right now, people don't, it's not making the news because it's regarding the Catholics who are filing lawsuits to protect their own businesses and their own rights and their own hospitals. This just came in tonight. Obamacare mandate threatens religious freedom. Mr. John Kennedy, who owns Emmacor, employs 700 people. His business is directly affected, and so he's filed a lawsuit against the government. In his case, he would have to pay $16 million in fines a year to protect his 700 employees. Catholics do not believe in abortion. It's against our religion. Also, people don't realize that 1 out of every 5 people in the United States who goes to a hospital goes to a Catholic hospital, is being treated in Catholic hospitals. Catholic hospitals do not provide abortion, and they do not provide benefits. They have health care already. They do not provide health care benefits for abortion or contraception. It's just against our religion. So it's an article on religious freedom on its face. The Thomas More Society has filed 7 lawsuits. They've been filed this last week. Again, the same thing. There are a total of 73 lawsuits right now being filed between the Beckett Fund and the Thomas More Society. You're not hearing them in the news. They don't come up. That doesn't come up in any of this discussion about our religious freedom. Number one, it's one of our freedoms being taken away. But now the Catholics are getting mad, and this is the first 2 that you're going to be hearing about because they're going directly to the Supreme Court. They have to hear it.
Right. Well, and I agree with that. And I'll be honest with you, the American public has not been informed enough to start getting mad. And that's what the problem is. You know, we have been silent. We have not been aware of what's going on. We've kept our heads down in the sand. I see it still today with business owners. You know, I've been talking to them. Do you guys know what's going to come? Do you know what's going to hit you? Do you realize what's going to happen? It's never going to happen. It's never going to happen. It's never going to happen. They finally started poking their heads out of the sand this year when the 2014 deadline was going to hit. And then as soon as the government came and said, oh, we're gonna post that till 2015, whoop, down they went, just like prairie dogs. So we do see that.
One last question.
Yeah.
So, for the most part, the insurance companies are not gonna go broke with this. They just raise the premiums.
They just are gonna continue to raise premiums until it becomes that.
Okay, so to beat the system, we should buy stock in the insurance
There
company.
you go.
Give me some
There you go, there you go. You know, just on one last note, you know, there are folks out there, California has about 7 million uninsured. Out of those, about 2 million are illegal, or in our state illegally. There's 5 million that are uninsured. Out of those, there's about 2.5 million that already qualify for some sort of government assistance program that's out there. The expansion of Medi-Cal is going to insure a lot more of those. So we're not talking about a huge part of the population that really does not have access to care. I do believe that everybody should be able to get insurance without having the exclusions for pre-existing conditions. I'm going to tell you right now, I have a type 1 diabetic daughter that's 26 that is uninsurable because of her health condition. She's willing to pay a price for that. I do think that we could have done this entirely different, where we could have said, okay, everybody has access to the insurance without being penalized because of pre-existing conditions. We will have one open enrollment period, just as we have open enrollment for Medicare. If you don't buy it then, guess what, folks? You're going to pay more for your insurance down the road, because why should the rest of us foot the bill for those folks that are not being responsible? Number two, I truly think that everybody should have a high deductible plan, a minimum of a $2,000 deductible, so everybody has skin in the game. I don't care if you're on welfare or not. I truly think everybody should have a $2,000 deductible. Payments could be made for whatever services you need with that. You got to have a little bit of accountability. You got to have some skin in the game. But I also think that the insurance companies need to give us the tools to shop for our health care. Right now, I have folks that have these high deductibles, and they call my office and they say, hey, my doctor just ordered this whole lab slip for me. How much is that going to cost me? Because, you know, I've got a $5,000 deductible. And I know what I'm doing, and I speak the language, and it takes me sometimes a day and a half to get answers from the insurance companies and the labs on what it's going to cost this person out of pocket to get this work done. We need to have the tools to be responsible to shop for our own health care. If we did those things, oh, and probably some incentives for taking care of ourselves. And I'm not saying everybody's got to be skinny and everybody's got to do this, but if everybody would at least go in and get an annual exam, you know, get a little bonus for that. Maybe your deductible goes down a couple $100. If you go get your biometric screening, your annual lab work, you know, get a little reduction there. So do provide some wellness screenings. If we did those things, I personally think that would have been the direction to go instead of a mandate here of insurance for all. I just don't think that we need to be telling people that they have to have health insurance.
Thank you.